Managing the telephone is one of the most important jobs in the medical office. In addition to face-to-face interaction, medical assistants often speak to patients and other callers over the telephone. In fact, the telephone is often the first contact between the medical office and a patient. Therefore, it is the first chance the medical assistant has to project a positive attitude and image to a patient. Interest, friendliness, concern, and understanding are clearly communicated over the telephone, as well as boredom, anxiety, indifference, and frustration. Telephone calls should be answered promptly, preferably before or by the third ring. If a patient must be put on hold, the medical assistant should first find out who is calling and why, then check back with the caller frequently. A physician should not be placed on hold if it can be avoided. When handling a call, the medical assistant should not chew gum or eat. Also, it is important to pay close attention during the phone call. A caller can tell if the medical assistant is distracted. The medical assistant should be clear, speak naturally, and enunciate. To avoid mumbling, it may be necessary to speak a little more slowly on the telephone. It is important to avoid cutting into a caller's replies, even if the caller rambles or repeats himself. This procedure demonstrates how to take a telephone message in the medical office. When it is appropriate to take a message, the medical assistant uses a message form. Some forms are pressure sensitive so that a copy is created with the original message. The originals stay in the message book and form a telephone log. If the message form does not create a copy, it is helpful to keep a separate telephone log for future reference. In some offices, a form is used that has a space at the bottom for the physician to write orders or desired follow-up. The medical assistant should not write in this space when taking a message. If you determine that the person a caller wants to speak to is not available, offer to take a message. Give the caller a reason why the person cannot take the call. Acceptable reasons are: the person is busy with a patient, the person is not at his or her desk, the person is not in the office, or the person is on another line.
I'm sorry, Dr. Warner is with a patient right now. Can I take a message?
Fill in the information on the message pad. Begin with the date and time.
I'm calling to get the results of the ultrasound I had last week.
Now, was that test done at Memorial Hospital?
Yes, it was.
Can you please give me a phone number where the doctor can locate you?
490.
If the patient is calling about a medication, be sure to ask about allergies and obtain the pharmacy telephone number. Lastly, write your initials at the bottom of the message. If possible, give a time when the call might be returned. If the message recipient does not have a scheduled time to return messages, say, "I will give him or her the message." If the call is from a patient or concerns a patient, pull the medical record and clip the message to it. This ensures that information about the patient is available and the action taken on the call can be charted if necessary. Place the message with the patient record, if needed, where the person for whom it is intended expects to find messages. This may be on a desk or in a mailbox.